8 in 10 Brits with regular pain issues are struggling with day-to-day living. More physical ailments such as back troubles, arthritis, or skin conditions mean 40% of these can't remember the last full night's sleep they had. The research by Curative Clinic has also found the same amount can't comfortably exercise and 30% struggle with household chores. Well, here to discuss all of these back problems and what you can do to solve these problems is Dr. Emeka and Dr. Simon Eridge. Guys, welcome to Gateway, and I hope I got that right.
Yes, you did. Thank you very much.
So, guys, obviously, someone that's getting to, I know I don't look it, but I'm getting close to 40. Back problems and sleeping are starting to creep up on me. So this is something I know all about. What has this research that Curaleaf done really shown you guys in your field, and what can it show us as people that are suffering with back problems?
That's a good question. So the Curaleaf study looked at about 2,000 people who were suffering with regular pain issues, and just basically wanted to highlight how debilitating these pain issues can be. Because a lot of people, and especially here in the UK, a lot of people live with chronic pain and they manage it. A lot of chronic pain is unfortunately uncurable, but manageable. So I wasn't too surprised by a lot of these statistics, because I know, obviously, just from seeing patients, how many patients come in to the NHS, whether it's been A&E or in primary care, with pain issues, especially lower back pain issues. So this basically highlighted that for people with chronic pain issues, as you may know, we try and use conservative methods. So that's lifestyle changes, changes to your posture, changes to how you're sitting, changes to your occupational work environment, all the things we could do to, alleviate pain on the back, for example. And then if this fails, obviously going to tailor this with medication. However, a lot of people don't realize that when these conventional methods have failed, there are potential alternative therapies which may provide relief for pain for chronic patients. And that's what Curaleaf are trying to highlight. We've basically been here because of the Health Desperation campaign. And this is because a lot of people who are suffering with chronic pain, such as back pain, who aren't getting relief from conventional methods, are turning to illegal, illicit substance use to try and manage their pain. And although this may report that it works, it's not necessarily safe or legal. However, there needs to be, legal, safe alternatives which some patients can benefit from, and that's what Curaleaf basically provides. Consultations with specialist doctors and consultants who can prescribe cannabis-based medical products that can provide a benefit when all of the measures have failed.
Okay, yeah. So you touched on cannabis-based products. Obviously, for someone that, as far as I know, everything to do with cannabis in this country is illegal. But obviously, are you saying that there is stuff out there that we can legally use in the UK? Obviously, just going by street knowledge of me thinking I'm cool, that these products are a way forward, and it could be. Would this also push more cannabis products to be made legal down the line over here?
Yeah, that's not unusual, and what we've highlighted consistently with the research is that many people don't know that medical cannabis can be legally prescribed here in the UK. 1 in 2 people, in fact, don't know that is an available option to them. And ever since 2018, the law has changed so that for people who have tried first-line medications through their GP or their specialist, it is now an available option to them. And what we're trying to do is make sure that we are investing in research and education and awareness so that people are fully clued up as to what available options are out there for them.
This is why I asked, because I suppose it's that misconception. Obviously, we know if you're someone that maybe likes a bit of cannabis, Amsterdam, or you can go to America and it's legal, but it's something I did not know the laws had even eased or changed in any way over here. So it's quite a big thing, and I'm hoping it doesn't mean our listeners are going, does that mean I can go get it for free and legally now? No, that doesn't mean that. It means that medically these things are becoming available to us in the UK. And obviously you touched on substances and people turn into pain relief and stuff like that, and that's something I was thinking about. Is obviously a lot of people probably don't come to doctors with problems with their back, that sometimes they just, I'll take these tablets, I'll take more of these because it's helping, and then it becomes an addiction, doesn't it? And obviously that's something you guys as professionals especially would not want to happen.
Exactly that. As in, we don't want any addiction to any substances. Like, when we're prescribing medications, we're doing so because they're regulated and we can see exactly what the effects of these medications will be on your body, adverse effects, how much you're meant to be taking. Obviously, we're governed under nice guidelines in terms of what we should be prescribing and what's safe based on the research that we've done. If you're then taking a number of different substances or a cocktail of different substances, or you're taking too much of a medication we prescribe to you, we don't know what the adverse effects on your body could be. However, they could be detrimental. And so it's a case of patient safety. Obviously, we know that people are going to turn to these because they want to turn to a solution, whether or not it's going to have long-term adverse effects or not. If they say, if I take these 6 cocodamols, my back pain's going to go, and I'm going to need these 6 cocodamols. And obviously, we know that that can lead to addiction. It can lead to tolerance and tachyphylaxis. It can also lead to severe side effects that opioids may bring. And that's why we try and advise people to only take what their doctors have prescribed to them, when and how their doctors have prescribed it. And then if they are suffering from chronic pain, which isn't responsive to these medications, that they come and see a health professional and at least explain that. And then yourself and your medical professional can tailor a plan, whether this may be increasing the dosage or the frequency, changing the drug, adding the drug, or referring you on to a health specialist who could prescribe you potentially something else.
I get that, and like I said, I think, like I say, sometimes it's just easier rather than seeking the help from a professional. It's just easy. Oh, I can go to the shop. I can get this, or I know someone that's got cocodamol or stuff like that. But the other thing I was thinking about, addiction is one of the issues. Or sorry, taking self-prescribed medication is one issue to help with back pains. But another thing people may think of is worrying about, I have these problems, but I'm also worried that it's going to cost me a lot of money to fix these problems. Is there any advice you would give to people that are, worried about money, not just the addiction side of it, but the money side of things, of potentially fixing any problems they would have with pains and back pains?
Yeah, of course. I think in addition to those that you mentioned, I think a lot of people are maybe don't want to necessarily, I see this quite a lot, like want to bother doctors. They feel like they aren't validated in their pain. They feel like they don't want to bother doctors, but actually this is what we're here for. We want to see people early and often, and actually engaging more with your healthcare professional is only going to lead to actually an improved outcome and a reduction in those costs long term if you're able to get on top of things early with the right types of treatment. I think the longer that you put things off and you try and take shortcuts to try and manage your pain, that's when you're putting problems off for the future, where your body maybe isn't going to be as tolerant to you having poor lifestyle choices or whatever it may be.
Okay, so yeah, I see that, and obviously, as I said, like, because I'm getting to that age, and it's one of the things you think, oh, it's just natural. I'm struggling to get up in the morning because I'm just getting older, but no, there are options. And maybe me choosing to go from the age of 15 to nearly 30, thinking I was going to be a professional wrestler, could have caused me problems for later on in life. Taking all these bumps and jumping off of things was not a good idea, but there are ways and help out there. Is there anything you guys would like to, point out and put across to anyone listening that is just sitting at home and think maybe it's not the addiction side of it that you think you're worried about, or I'll just take that option, or it's not just the money? Anything that people with back problems, any other advice you would give them that we haven't come across in our chat?
Yeah, I think the key thing is always to be aware of your options and to do your research and to engage with healthcare professionals. And we at Curative Clinic, we've put together an educational resource that's not just about medical cannabis. It's right about chronic pain and other conditions that we see. So if people go to curativeclinic.com, we have lots of educational resources where people can find out about the causes of chronic pain, current treatments, and what options are out there for them. I know it may feel to people who are there sitting at home who experience chronic pain that they're out of options. I'm here to say that that's not necessarily the case, and it's important to seek help when you need it.
Absolutely. Guys, it's been lovely to chat to you. Before we finish up, where can our listeners go for more information? Where can we find out more about this?
Yeah. As I mentioned, curativeclinic.com, you can complete an eligibility checker, lots of educational materials, and if you contact us through there, we'll happily get back to you.
No worries, guys. Thank you so much for the conversation. It's lovely chatting to you, and hopefully that's the end of your day and you can go relax now.
Oh, amazing. Thank you so much.
Cheers. Thank you very much.